Hey everyone, and thank you for joining us for Generational Health Series today. I'm Dr. Mish, and I'll be your MC today, if you will. Generational Health was founded to raise awareness about various health conditions that unfortunately affect our community at disproportionate rates. It's our team's mission and passion to make sure our community is well educated and well informed with the goal of preventing said health conditions. Today, I'll be joining Dr. Jess Motley as she discussed the importance of movement, spreading knowledge about musculoskeletal injuries and chronic pain. Dr. Motley is a second-year family medicine resident at Ohio Health's Grant Medical Center in Columbus, Ohio. Alongside being a fabulous and passionate physician, she also has an extensive background in sports medicine and musculoskeletal injuries, having previously worked as an athletic trainer. So it is without further ado that I hand the mic over to Jess and allow her to share more personal information about herself before diving in and schooling us on this topic. Hey, Jess.
Hey.
I mean, Dr. Motley, I'm sorry.
No way. I'll always be Jess. I'll always be Jess first. How about that? Thank you so much for that awesome introduction. I appreciate it. And I love Dr. Ford because she has put together an awesome think tank of beautiful women. And actually, do we have any guys in our group? I don't think so. Beautiful women that are holding it down. We're recruiting actively. So if you want to be a part of us, you let us know. But I think that they've done a beautiful job thus far. And I'm just happy that I was thought of to be a part of it. So thank you. So my name is Jess Motley, and I am a PGY2, which means a second-year resident at Grant Family Medicine. Like Jamisha said, I have a big background in sports medicine. So I wanted to talk to you guys today about like the importance of movement and particularly how to manage some like acute injuries and things. So,
hey Jess, should we be looking at your PowerPoint right now?
Yeah, can you not see it?
I see your beautiful face.
You only see my face? I don't know. I'm sharing it. What happened? Can somebody help me? Let's see. I'll try to share it again. Give me a sec. What about now?
Am I the only one who just sees Jess?
I see the PowerPoint.
It's just me. Okay.
Oh, okay. If anybody has any questions, please put them in the chat. Jamisha is going to help. Dr. Ford is going to help me kind of co-host and moderate. And so she'll keep an eye out on questions that might be coming in. Or if you just have thoughts. I honestly don't mind if you guys want to chime in, but I know sometimes coming up on Zoom and people get a little bit intimidated with the mic. So if you want to do questions, that's absolutely fine in the chat. Somebody's blowing me up right now. So here we go. Let's see how this works. So our agenda for the talk today, I'll introduce myself a little bit more about my background. We'll talk about why movement is important. We'll go over a couple cases for case-based learning. I always feel like that helped me the most as I went through my medical career. And I think it's an easy jump because a lot of people may resonate with some of these cases that I talk about. And you guys will have like a shot to be the doctor and kind of guess or elaborate on what you think should happen next. And then we'll talk about clinical pearls. Those are good takeaways that I hope I leave you with just a couple that you remember. And then we'll leave with a closing case and conclusion for the day, okay? So a little bit about my journey to medicine. I'm from Columbus, Ohio, born and raised about 2 miles from Doctors West Hospital for most of my life. I got into sports at a pretty young age. My childhood best friend's grandfather looped me in, and since the age of 10, I have probably been involved in some type of sport all the way through my
Hey Jess, I'm sorry to interrupt, and it's not just me, but apparently the slide is not moving forward. So we still see keep it moving.
Oh, okay. Let me see. I don't know how to fix it.
Enable editing, maybe.
What happened?
Someone said try enable editing.
It says enable editing. Oh, maybe I need to have permission.
Go to that top yellow bar where it says that, click the enable editing there.
Let's see. Top bar.
Do you see a yellow bar at the top, like protected view?
No, I only see a green thing that says
Oh,
I'm screen sharing.
No,
yeah, I
on
see it too,
PowerPoint.
Jessica. Right at the PowerPoint at the top, underneath home and insert and all the tabs at the top, it says enable editing. It's in protected view. Sometimes that makes it not move.
Just on the actual PowerPoint.
Hold on.
There we go. We're seeing
Yay.
stuff. Yeah,
Good job. And Angie
Thank you
holding us
so
down
much.
from Indianapolis. Thank you, girl.
I've done a few of these. Love ya.
Okay, what do you guys see now?
Good, you're in PowerPoint view. Yep.
That's good. We got it. We see agenda right now.
Perfect. So that was the agenda. I'm so sorry. Thanks, Aunt Angie.
No problem.
So a little bit about my journey. Like I said, I'm from Columbus. I got into sports at a super young age. Does anybody know what superstar this is right here? No, no one? Oh my God. I'm so sad. So I picked up the shot put probably sometime in middle school. And I went to college and was continued to be a thrower. And this is Michelle Carter. She was our gold medalist shot putter at the last Olympics. She's not competing this year. She retired after she won the gold. But this year we still have pretty good running to win the gold again. I have always had a love for sports as far back as I can remember. Went to Wright State to throw, became an athletic trainer, which furthered my career in sports medicine and really taught me a lot of hands-on skills that I still use to this day. Set me up well to go to University of Dayton to get my master's degree and continue working with their college athletes. And then I got the bug. I went back to Wright State to work, got the bug to kind of do something bigger, help my community more, have a bigger platform. And so I went to OUHCOM and I loved it there. And I had a ton of great experiences, and my family and friends held me down through the way. So I'm huge into family, huge into connection. I think that that's the best thing that we can do for each other is love each other. So that's a little bit about me. And so I want to talk about movement today because I feel like it's super important. Movement is tied to healthy minds. There have been studies after studies that show the impact of exercise and even like not even, I think sometimes when people think about exercise, they just think about running on a treadmill or going to the gym. And that's not some people's like a happy place. Some people enjoy that immensely for exercise, but other people don't. But exercise can be anything, any kind of activity. And so there have been studies after studies that show an improvement in mood, overall mental clarity after exercise. Our body releases endorphins and special hormones that make us feel great afterwards. And so that's just one small aspect. The next aspect is healthy hearts. That goes beyond saying, I think that's the benefit that most people know is that it's so good for your body. And it's also good for healthy joints. And I'll talk about the physiology of why that is. And so all those things equal an overall happy body. And so I think, especially in the time of COVID, when most of us were sedentary, that we need to be reminded that movement is healthy, movement is good. So what happens when movement is interrupted? Injuries and illnesses happen. It can be a super stressful time. My mom just, I'm sharing your business, Mom, don't be mad, but she just had a procedure on her foot that severely limited her mobility for the last month. And just the times of frustration that she had where she just couldn't do what she wanted to do. And she lost a lot of her independence. That can be extremely frustrating for people. Acute and chronic musculoskeletal injuries. So those are injuries that happens to our muscles, tendons, bones. They make up of 40% of our primary care visits are complaints for that. So they are extremely, extremely common. Early recognition and appropriate care is super important for not only like early recognition, but early treatment and then hopefully early return to normal life. So I think the study of movement and paying attention to that is crucial. And so that brings me to the case-based learning portion. So we'll go through just a couple cases, and I hope that you guys chime in the chat and let me know what you think about some of these. If you guys have answers to some of these probing questions that I have. Jamisha is my co-host, so I want her to fill in some of this silence if she has an answer. Sorry, I'm at work still, friends. That's the light that turns off when I don't move. So we will do this. So case one, It's the I felt it pop. Okay. So Cedric is a 37-year-old man with really no past medical history. He's been a pretty healthy guy. He works as an IT specialist, which is sometimes a sedentary job, but on the weekends, he's an avid basketball player. He comes into your primary care office today after injuring his calf during his usual Saturday morning rec league basketball. He tells you that he was going to change direction and he felt a pop in the back of his leg. And, he was unable to return to play that day. He hasn't hardly been able to walk on it or place any weight on the leg. When you see him, his calf is warm and swollen and pretty tender to the touch. So that is Cedric's case, okay? So first thing we think about after we hurt ourselves in real life is like, what are we supposed to do about this? So I have some options, A through G. They are choose all that apply options. Go ahead and put in the chat which options you think that Cedric should do to take care of his injury in the early courses of things.
So we're getting C, D, F. Honestly, I honestly feel like I would do all
F, G. Yep. I
Yep.
like it. I like it.
G.
Couple more seconds here. Okay. Forever hold your peace. So I'm going to go through each one and we're going to talk about whether they're right or wrong. Okay. So massage witch hazel over the sore area 3 times a day. Who knows what witch hazel is? Can I get it? There's like little emojis in Zoom. Like throw up a little emoji if you know what a witch hazel is. If your grandmama was old school, give me a little thumbs up. So it's actually surprising that witch hazel does have anti-inflammatory properties. However, has not ever been shown in any kind of research or controlled studies to really have much of an impact in musculoskeletal injuries or inflammation in joints and things like that. So it might make your skin tingle and it might be good for your complexion, but it's not going to be good for this calf. That's option B, soak it in a warm Epsom salt bath. Who uses Epsom salt baths after they're sore or after, like for any reason actually? Little emojis? No. So Epsom salt baths are pretty common for people like have sore muscles. They usually sometimes think about that first. And Epsom salt or warm baths in general can be therapeutic. However, in the cases of early injuries, when you apply warmth to something that has just gotten injured, that will set you up for a worsening sequelae of the injury and of the swelling and of all the cytokines. Cytokines are special hormones that tell your body that something's injured. It actually just increases kind of some of that bad stuff to the area and it can make your swelling tremendously worse. So you want to avoid warmth after an injury. I don't care if you put the Epsom salt in cold water, that's fine. I don't think it's going to work that well, but you definitely want to avoid warmth. So that's something that sometimes people get confused when to use heat versus cold. Okay. For C, I saw a lot of C's and that makes me happy. So ice therapeutically, I think is super beneficial for pain control for sure. We do know this, that it slows down nerve conduction of pain stimuli. However, there has been some conflicting evidence as to whether or not ice really helps healing in the long run. And so what I tell people is I'm trained as an athletic trainer. You're not going to take my ice away. We've been using ice in the athletic training world for as long as trainers have been a thing. And so I have seen benefit from it just with my own hands-on just experience. So ice packs for 10 to 15 minutes. You can do it as often as every hour, can be tremendously helpful for pain control and to help limit swelling early on. So definitely C. D, avoid aggravating the area to prevent future injury. I saw some D's out there. That's absolutely true. You want to protect this thing, okay? E, massage the painful area until the pain is relieved. Who believes rub some dirt on it and keep it moving? Who's heard that before? Anybody? Little hands up, little emojis if you have. Yep. Some people have heard that, right? And so acutely in an injury, especially when you don't know what's wrong, you want to try to fight that urge to rub it a whole lot. When tendons and fibers are damaged, those connections of how they usually bridge together are kind of separated. And so if you rub that area or massage it deeply early on, if you're not a trained professional, then that can actually precipitate further tissue damage. So you want to try to avoid that one if you can. So that's another myth, okay? F, go to the emergency room for prompt evaluation. I saw some votes for this, for F. And I honestly think that sometimes when we are injured initially, and it really impacts our ability to do daily activities, so walking, so our guy couldn't really put weight on his leg. Anything time that is super swollen and you're like, man, I can't get this pain under control, it's always a good idea to maybe seek professional care quickly. And that includes emergency room visits, and it also can include urgent care visits. If it's a weekday and you have a good relationship with your primary care doctor, sometimes they can get you in for an acute visit, but often that's not as easy to access. So F is a gray area for some people, but when in doubt, if you can't use it or move it, then get it looked at quickly, okay, just to rule out all the bad stuff. And then last, elevate the area to help relieve any swelling. That is absolutely true. Gravity, you have to fight the effects of gravity. Gravity will just allow that swelling to stay in the leg, and you want to get it out of there. And so you want to raise it above the level of your heart for acute injuries that have a swelling component to it. Good job, friends. Most of you had all of them right.
Yes, just clarification, because you keep mentioning or saying this word. Can you tell everybody what acute means?
Yes, thank you,
What an
Janisha.
acute injury is?
So an acute injury is something that happens within usually 24 to 72 hours of an incident or an assault or an injury. And so for that short amount of window of time, we have a pretty good idea of what the body's doing to help you heal. And we can do things to kind of help that process along, as well as to not allow that process to take over for too long and cause us more injury and swelling in the past. Chronic injuries or chronic conditions are ones that kind of last longer than 3 weeks. And so sometimes people will have, we'll talk about chronic things in just a little bit. So that kind of gives you an idea of what I mean by chronic versus acute injuries. Thank you for that clarification. So a good way to remember what to do after an injury, you want to think RICEs, okay? So that's the rest that we talked about, the ice that we talked about. We didn't talk about compression. So compression can be nice to help with swelling. If you have ACE wraps at home, or some people have like leg sleeves at home, the important thing is that you don't want to compress so tightly that you're messing up the circulation by cutting it off. So you always make sure that away from where you have wrapped, or further away from your heart after the wrap, is still getting good blood flow. You can do that by kind of pinching the tip of your toe if you're wrapping your ankle or your leg, and making sure that it pinks up within 3 seconds. You can also check pulses if somebody knows how to find distal pulses, or if you have nurses or healthcare people in your house. But mainly if it's falling asleep, then you wrap it too tight. So loosen it up a little bit. And then we talked about elevation, getting that limb above the level of your heart. And then lastly, support. Support kind of goes along with protection of the area. And so for the case of our guy, he'd probably need some crutches since he can't walk. He might need a little sleeve or brace for that calf to give it just a little bit of muscular support. So think RICE is when you're wondering what to do after an acute injury. So when to seek care. We talked about this a little bit when it came to urgent cares and emergency rooms. Anytime you think you have a fracture, you broke something, or you need stitches, those are automatic. Go to the urgent care or to the hospital, okay? Because you're going to need an image, you're going to need a professional to see you. Anytime your pain's uncontrolled, having a hard time sleeping, can't get comfortable, you definitely want to be seen, because pain is usually a good guide for our bodies to let us know when something's wrong. And then again, anytime it interferes with your activities that you want to do day to day, getting up, going to the bathroom, taking a shower, getting in the car, et cetera, et cetera. Family medicine providers or your primary care providers, they can help with an initial evaluation and give you guidance on treatment. So something that maybe is not so urgent or emergent, so you don't want to go to the emergency room, but you can get in a couple days, or especially within the first week. That can be fielded by our general practitioners. I think that they do a good job of identifying red flags versus things that can be managed at home. And then lastly, your sports medicine physicians and your orthopedic surgeons, Those are going to be your musculoskeletal experts. They're going to know definitive treatments for most musculoskeletal injuries to kind of help things out. They're going to be able to rule out whether or not they think that you might be a surgical case, meaning that you need surgery to help fix your injury, or if it can be just be treated with things in the office like physical therapy, injections are options, other medications are options, supervised rest, those kind of things. And then they can also help with the ongoing management, because a lot of these things take weeks to heal, sometimes months. And so it's important to have somebody following along to make sure that you're on the right timeline of healing. So let's talk prevention. Sprains and strains are the most common of all the musculoskeletal complaints that come in. Sprains and strains are the most common types of those complaints that we see in our primary care office. So let's talk prevention tactics. So our guy was 37. Do I have any weekend warriors on the line? Anybody who likes to play pickup games, flag football? We used to do a turkey bowl where we would take the old cousins, the 30-year-old cousins would try to go out and play a sport in the middle of winter and race each other in the yard or whatever. And somebody usually got injured during that time. And so good prevention tactics, especially as we age. And I'm talking age like 30 to 50, particularly because sometimes you think you still got it and you try to go out there without warming up and it just doesn't work out that well. So just remember and be mindful. And you can teach this to kids too. This is important for everybody. Before you know you're going to do physical activity, make sure you take time to warm up, do some light cardio, get your blood flowing, jog around. It's always better to stretch warm muscles than it is to stretch cold muscles. And then after activity, it's also important to cool down, doing some similar activities that helps get some blood flow through those legs. In the sports medicine world, we talk about lactic acid and like byproduct buildup from the exercise that you had. Sometimes it helps to flush that out with a little bit of exercise even after your main activity. And in order to avoid going from 0 to 100, that's another reason why it's important to kind of stay more active and more mobile as we age, just in general. By making it a part of our routine, then our bodies are kind of already geared up and prepared for activity. We get into trouble when we become more sedentary than we should be, and then try to go out and then immediately participate in kind of higher velocity activities. So keep that in mind. So what happened to Cedric? Cedric started his Rice's therapy at home. So he did those things we discussed to help his initial injury. He got scheduled for an ultrasound, a diagnostic ultrasound, to see what happened to his muscle. And he had a mild strain of his calf, which was good because we didn't want Cedric to have surgery or anything. He did some PT for 6 weeks, which is physical therapy and rehabilitation. And then he also did home exercises along with that physical therapy that he received. They coached him up on some proper warm-up techniques. And as he's still working on his strength and speed, he was able to return to his basketball successfully. So he loves it. All right, next case. Case number 2. My knees feel 80. Man, show of hands, little emojis. Whose knees feel 80 most days? Woo! Oh, Lord. Let's see. Absolutely. Somebody feels me. Yes, yes, yes. So this is Miss Stacy. Miss Stacy is our 57-year-old female who came to the clinic, and she complains of about 2 months of worsening knee pain. So she comes in, she's like, I always had bad knees. But recently the pain has just gotten so much worse. She notices that her right knee even looks swollen at times. Most of the pain has been when she's been sitting or sedentary for a long time, and then she tries to go and move quickly. She also experiences pain when she goes from low to high, so squatting, going upstairs and downstairs, going from sitting to standing. And it's starting to affect her everyday activities. You know, she likes to do things like walk and spend time with family, and she's just not able to do some of those things because of her discomfort. She does say that since COVID has happened, she's been a lot more inactive, and she's asking you, do you think that that inactivity has something to do with it? What do you guys think? Yes, from everybody almost. Absolutely. Anybody else's knees are starting to feel 80 after we've been sitting on our buses last year? For sure. So what are your initial thoughts on Stacy's concern? I know we talked about the inactivity. What if she said she was doing like a lot of activity? Could she still have similar symptoms, you guys think? Yep. Absolutely. Too much stress is also kind of can play a part in how our joints feel, right? Perfect. And then what kind of treatment options have you guys heard for old knees? Anything anybody wants me to touch on specifically or has heard of and had a question about? Throw it in the chat. We'll touch on some things. Jamisha, keep an eye on that chat for me, boo. Okay. So care of chronic injuries. What Miss Stacy has, I would consider a chronic condition. So she's telling you that she's got years of this pain, but now over the last couple months, the pain has even gotten worse. And so the chronic cycle of chronic injuries is one that you always usually have like a baseline of discomfort or a baseline of dysfunction that you know that your body is like, oh, it's not like it used to be. But then you also have these peaks and valleys where, you know what, I feel pretty good in baseline. I'm not doing too bad today. I think I'll try to do a little bit more. And at the same token, then sometimes you have these kind of lows where you feel like, oh my gosh, I'm so sore, I'm so tired, I'm so swollen, achy, et cetera today. And that is kind of the course for most chronic conditions, whether it's back pain, knee arthritis, shoulder issues. Some people have wrist issues. And most of these chronic issues come from overuse, and some of them just come from natural aging, unfortunately. So our goals for maintaining our chronic injuries are a little bit different than the acute injuries. Acutely, when something happens, we want to manage that pain, swelling. We want to protect. We want to almost immobilize for a little while, just until things heal. But for chronic injuries, our goals are going to be opposite of that. It's going to actually be maintaining as much function as we can safely. In chronic injuries, immobility will actually make them worse for the most part, especially complete immobility. Things that make them better are continued activity, but targeted activity that allow you to strengthen the muscles to help best support the areas that are injured or kind of worn out. Most people know there's a ton of things out there for chronic stuff. You got your ice, your heat, your Tylenol, your pain patches. Shaq's got a little shocking machine you can get from CVS. You got hot tubs and cold ice baths, and there's even fancy tape out there if anybody's ever seen kinesia tape. There's a ton of stuff out there to help people's joints feel better. And whenever you see something with a bunch of options, know that none of those options are going to be perfect. And so you really have to build your own routine of what makes your body feel best, okay? And that comes with trial and error. You got to give yourself some grace, because a lot of people think that as they age and as things happen, they get a little bit down on themselves, like, oh gosh, my body, woe is me. But you just have to understand that you are where you are. We're going to save as much mobility as we can. We got to still continue to do what we can to kind of support yourself through that. Medical professionals, particularly sports medicine and MSK professionals, can also help with interventions, and we'll talk about those in a second. But that's usually like the overall picture of chronic injuries. It's just something that's kind of frustrating, but with the right help and the right support, we can actually optimize what we have left.
Hey, Jess, we have a question in the chat.
Yeah.
So as you're discussing chronic injuries or even chronic pain in general, whether it just comes from normal wear or tear or not, can you talk about the safety of steroids, whether it's, steroids by mouth or steroids that are injected, and who they're good for, how long they last, and the side effects that they have?
Yeah, absolutely. We can talk about that. I will add that in 4 slides. Okay. Don't let me forget though. And you'll see it kind of pop up on one of the slides, and then we'll kind of dig a little deeper. I want to talk about rehab first, because everybody likes a cortisone shot who's had them. They're like, oh yeah, that feels really good, really fast. However, those things do wear off. Okay. And the key for longevity and the key to kind of giving us as much function as possible is our ability to rehab. So rehabilitate or strengthen the areas that we have our deficits in. So the goal of rehab is to improve strength, balance, your flexibility, and your movement patterns. And those have to do with like neural pathways. I'm going to dip into some nerdiness and you guys are just going to have to hang with me. And I promise I'm going to try to make it as lay term as possible for my folks who are not in medicine. But it's important to at least have a concept of that both nerves, your muscles, your tendons, your bones, they're all working together to give you this function. And so the goal of rehabilitation is to take all of those components together to optimize your mobility. There's usually a targeted approach to find certain imbalances and weaknesses and address them systematically so that you're going from not from 0 to 10, but a stepwise progression to learn new patterns and then to build new strength, and that takes time. Rehabilitation programs are usually safe and effective. There are some times where people can get a little bit sore, and I don't want to minimize that feeling, because usually when you're already in pain and somebody makes you feel worse, you are like, what the heck? That's not why I came to you for. I wanted you to help me. I didn't want you to make me feel worse. But there is sometimes an acute flare of pain or discomfort that can happen and soreness that can happen. Just like when we exercise, sometimes for the first time you're really sore after our first workouts. It's the same way with rehab. I find that most of my patients give up on a rehab program after about 2 weeks because they feel like their soreness should be getting better by now. And so that is actually a normal response, is to still be sore up to 6 weeks in a rehab program. And I'll show you why here in just a second. Okay, this one will get nerdy. I'm going to get a little nerdy, but I promise, just hang in there for me, okay? There's 3 concepts. The first one are, how do our joints get fed in the first place? If you guys can see my arrow, can you see my arrow on my mouse? Perfect. So this is the synovium, or the joint capsule, okay? And this joint capsule has specialized cells inside that give us lubrication for our joints, okay? And this is called synovial fluid. There are you don't see any blood in this fluid. It's nice and clear and yellow. It's kind of a gold tint. And then this helps to lubricate the ends of our bones, which are coated in cartilage. Cartilage are the things that kind of cushion when 2 bones come together, okay? So specifically, just talking knee alone right now, your knee joint has no blood inside, and that's where our nutrients are usually, is in our blood. That's how our tissues get oxygen and all the good stuff. So how do our joints get fed if that's all it is? Your blood supply actually is in the bones, and the blood supply diffuses, or like kind of throws those little molecules, for the lack of a better term, to these tissues that line, okay? So that these tissues have the nutrients, and then they have to pass those nutrients on along into our synovial fluid. And so the way that our cartilage is actually fed, sometimes it gets fed a little bit from the inside out, but for the most part, it's this fluid that has to move around and kind of flow over in order for our joints to get fed. So you can imagine that if I stay immobilized without moving a lot, then my joints really aren't getting fed that well throughout the day, because I'm not moving that fluid around, okay? And so this is one of the key concepts that I think people have to understand, why arthritis gets worse when we're sedentary, why people who are more sedentary suffer more injuries and suffer more pain, is because literally you are starving your joints when you are immobile, okay? So that's the first concept. You really need to have this good drink of water for the joints by running your butt around, or at least moving a little bit, okay? So that's the first key concept. We're still there. We got 2 more. This was my favorite. So the SAID principle is the second takeaway I want you guys to kind of think about. So the SAID principle stands for specific adaptation to impose demands. And so that is a fancy way of saying that when I stress my body will make adaptations to the muscles, to the tendons, to the nerves, to kind of shore up myself so that I get stronger for that same demand. So that the next time that demand doesn't weaken me or make me hurt, I'm actually stronger and I can be prepared for it. And a simple way to think about it, if you've ever done a lot of like manual work or manual labor, especially if you really weren't used to it, you probably developed some calluses on your hands. Those calluses are a direct result of the increased stress that your hands had by whatever work that you were going to do. Same thing with blisters on your feet, or calluses that form on your feet. Your body is trying to kind of shore up those weak areas by building a bunch of skin tissue to try to protect itself. Well, your muscles and your tendons do a similar thing. And so from a rehab perspective, this principle doesn't really take completely into effect until almost 2 to 3 months into doing an activity. And so when we are talking about making gains and getting stronger and helping to heal and to strengthen like weak joints or weak backs or weak whatever, just know that this principle is how you're going to get strong, but it also takes time. So you can't really expect good results in just like the first couple weeks, okay? So what this graph shows us is that like the immediate increase, we see this big increase in the first 4 months. It can happen with your strength, with your nervous system, and then your muscles will start to hypertrophy, which means grow bigger and grow stronger at a much slower rate, okay? So your strength increase initially is mostly because your nerves are like, oh yeah, I got this, I can do this, I can lift this. But true strength and true muscle girth building and true like strength over time doesn't really build until we're way out here, like, you know, almost a year, okay? So just think about that when you, especially for us young physicians, when we're trying to coach somebody to stay in physical therapy. If you yourself need physical therapy, you just have to realize that these repetitive motions really take time, but this said principle will work. It will make you a little bit stronger. It will get you a little bit short up, okay? Second nerdy thing. You still in there? You still with me? Last nerdy thing. Let's talk movers versus stabilizers. A lot of times we have muscle spasms, muscle strains, muscle fatigue, because our movers and our stabilizers are confused as to who's doing what job. And what I mean by that is that we have really big muscles that are really good at moving us from one place to another. That's their main job. Then we also have muscles that are just responsible for keeping us stabilized, which means balanced while we're walking, while we're sitting. And they work for a very long time, but they're kind of weak because they're just sensing these small motions over time. When we start to have injury breakdown is when our big movers get tired and weak, and then our stabilizers are trying to work for them because they're not built for that. They're too weak for that. Or when our stabilizers give up and then our big mover muscles are trying to work all the time to keep us stable too. And then they get tired and then they're prone to break down. And so when we look for these movement patterns that are kind of wrong, or these dysfunctional movement patterns are what we call them, where somebody is using too much of their movers to do jobs that those movers aren't supposed to do, or their stabilizers are so weak that the big things are trying to take over and they just can't, that's when you start to get into trouble. And so your rehab professionals are absolutely 100% trained to find these imbalances and then fix them, okay? And so that's why I prefer for my patients to initially go to a professional to do rehab first, or somebody who's educated in exercise science. There's a lot of really good personal trainers out there that have done their research and done the education portion, and they recognize that too. Before I want somebody just to go home with home exercises, because it's tough for you to know as the patient, like, am I moving my mover or am I moving my stabilizer? I have no idea. Okay, so that's the last nerdy thing. Okay, did you guys hang in there? Does that make sense? Anybody have questions so far? I'm gonna take a pause for that. It always takes longer to type or to formulate an idea on Zoom than it does to just shout it out in the classroom. So, okay. So your rehab professionals are the plug, guys. They are the people who you should look for to help make us better after we suffer these injuries, or if we have weaknesses that we want to address, okay? It's a super cool field. I did exercise science to some capacity for a very long time. I even taught in an athletic training education program, and I know this stuff works. And so sometimes it's just a matter of reframing education so that people kind of understand why you're doing something. I think that makes it better to buy in. Okay, so what happened to Stacy? Stacy got her x-rays, and unfortunately her arthritis did get a little bit worse, okay? So she got those cortisone, those steroid injections, and then she started a strengthening program when she was more pain-free that focused a lot on lower body strength. And today she is active, pain-free, and living her life, living her best life. And so I had the question about steroids before. I think that steroids from a therapeutic stance can be super helpful, particularly when we are treating chronic conditions. or very acute conditions that are more systemic. So some people have like some rheumatologic conditions where your immune system is kind of doing some funky things with inflammation. And the best way to get that down is sometimes just to use a burst of steroids. There definitely are downsides to steroids. So I will talk injections only for now because we're just talking about joints and whatnot, not the systemic ones for just now. For the joint injections, we really like to try to space those out as long as we can, because we do realize that although it brings down the inflammation, which I'll asterisk because arthritis has a different kind of pathophysiology, which means like disease process that isn't true inflammation. However, we know that steroids still help the symptoms quite a bit, but it's a short-term solution. Whoever heals or finds the diagnosis cure or the cure for arthritis is going to be the richest person ever, because that is the most debilitating thing that we have, that we diagnose in our offices with not a really good treatment process besides hacking that joint out and giving you a new metal joint. And so in order to try to stave off or prevent somebody to have surgery as like far off as possible, you kind of use these palliative things, these things that just make us feel better, which includes steroid therapy, which includes steroid injections. The nice thing about the joint injections though is that it's just, it's local. So that means it usually only affects the knee. It does have some mild systemic effects, but not nearly as much as the pills that people would take for steroids. And so that's nice, but some of the like I guess worse outcomes. Mom got me. I'm sorry, I just said batter on national Zoom. But the poor outcomes can happen after a repetitive injection. Sometimes that can actually lead to faster tissue wear down. And so there's like a sweet spot where you have enough of the benefit of pain-free and good mobility so that people can become active and get stronger. That aspect of it actually helps prevent you needing that second shot for a lot longer than you would if you just sat around and didn't do much. But then there is also a peak where it starts to kind of come down again, where now we're introducing a steroid and the risks are outweighing the benefits. The tissue breakdown is too much. The steroid really isn't helping. It can actually make some tissue weaker over a long time. And so there's that balance that you have to make. There's no set like time frame or dosage, but we really don't like to do more closer together than every 3 months. You try to limit the number of years you use steroids over time, and eventually that person, in order to like have a functioning joint, they'll get to the point where they'll need a replacement. So did that answer the question about the steroid thing? Perfect. Okay, good. All right. This is our final case. We're going to talk about you guys for a second. We're going to talk about me too, because I think I need to hear this more than anything. So by adulthood, most people have experienced some kind of like debilitating injury or something that maybe took them out for a little while. And I just want to hear your thoughts about reflections about like how you felt when you were injured or when you couldn't really do what you wanted to do. Some of the more frustrating things that came with those feelings. And if anybody wants to like comment, and this is like a brave share, and if you don't want to, that's fine. And I know, and even Jamisha, my co-host, if she wants to chime in on these questions too, to kind of get everybody's time to like think about their own stories. But what helped you most in the recovery portion of that, you know? If you were able to get healthy again, like what would you want to tell somebody else? Like, hey, make sure that if you go through the same thing, this really helped me out. This really helped me get back to where I was going. And then if you didn't get back to your optimal health, like what were the things that you felt were barriers? This is a reflective time for us as young professionals and young doctors to also hear just like basic patient stories, particularly with this last question of how did the medical system help or not help during this process? Because we all know what we do is an imperfect profession, unfortunately, and we are working really hard to be good doctors when we're all done. So I'm going to take it to the chat and see what people have to say.
So we have someone in the chat. After giving birth naturally for the second time versus an epidural with the first, I could barely move my leg and also had joint pain. Seeing progress in mobility daily kept me motivated.
Nice. Yeah. And for ladies, like like pregnancy and delivery, it is super, super weird on your body. Like you have a lot of hormones that make things more flexible, that make your joints more prone to stretching because you have to get the baby out of your pelvis. So it's kind of necessary, but it can also leave you with a bunch of pain afterwards and can kind of like sit you down. So I appreciate that share, Ms. Harris. Thank you so much. And seeing progress is super, super like kind of get you revved up and get you ready and makes you want to keep going when you can kind of see results. Yeah, that's awesome. Thank you.
Another participant said that when she was injured, she felt dependent, which was hard for an independent person.
I know that's right.
I would want to like point out the beauty in her speaking past tense because she was able to recover from her injury. And oftentimes we have patients who have chronic pain and feel this way for the rest of their lives because some of these injuries or chronic processes, meaning they don't go, they last forever, right? And there is no treatment, or they failed multiple treatments, whether it's pain medication, whether it's rehab or physical therapy. And so I think the very important overarching theme that if I could stress is prevention. And like Jess said at the beginning, to continue moving.
Absolutely. 100%. 100%. And we'll talk about some ways that we can get moving here in just a second. I know I'm running out of time. So anybody else have last minute thoughts? Particularly like anybody have bad experiences when they were immobile or injured that they felt like the medical system really wasn't that helpful, or they had a particular provider who was, and this is why. And you can answer too, and we can come back to this as well. I'll give you guys time to kind of think on it a little bit.
Jess, I'll add a little bit. So right now I'm on a sports med rotation, and there are some patients who, the reason I threw the steroid question in there, because sometimes like for people who have like diabetes, they can see some of those systemic effects where their blood sugar gets skewed and things like that. And then when there are other comorbidities, for example, like if somebody can't take like ibuprofen or naproxen or some of those like NSAIDs that often do help with joint pain. One of the things I would like to see more and thinking about as a future provider is, like on the provider end, when it seems like you just kind of keep hitting like a dead end, or that there are just so few options to really help with the immediate relief, is like staying positive or staying lifted and like trying to share like hope for your patient, because like Dr. Misha was just talking about, like chronic pain, is very associated with depression and other like mood disorders. And it's important to try to keep hope alive and try to keep like patients encouraged. And part of that, like you're talking about, is movement. And we know that when the mood goes low, you're less likely to move. So I think, on that, and like that's something that the health system in general, I think, could do better.
Amen. Guys, Alicia is like one of my favorite med students. I had her when I was doing a pre-matric program, and I knew she was something special. Did you guys just hear her break us off on that? That is a great perspective, and I absolutely 100% agree. There have been studies that show that the best way to help, there was one study in particular that I have an attending physician who was like super into research, which I'm not, but that's okay. And he kind of quoted this and it made me shocked, like, wait, what? So people who engage in like litigation for chronic injuries, the best way to make their chronic pain better is to stop the litigation, because it's such an emotional trigger, or like an emotional tie to this pain, that the pain almost never goes away as long as if they're in litigation. I was like, shut the heck up. Like,
yeah, so like with depression and chronic pain, it's a vicious cycle because you're in pain and you get depressed.
Super vicious.
And being that pain has that emotional aspect of it, it just makes the pain worse. I think it's not funny, but around the time like when I was going through, a bunch of family deaths, I remember getting my eyebrows done and it hurt the worst it had ever hurt before. And it's because like emotionally I was hurting, and it just manifested physically. So that is very important. So I'm really glad that Alicia brought that up.
Absolutely. Absolutely. And as if we go through these things, like I want to end on prevention because that is what I want to do as a primary care physician, as a future sports medicine physician. I really want to kind of target on prevention. But just like Alicia said, like be insightful of those feelings. You have to honor kind of how you feel, absolutely, but try not to stay in it, because when we have that mindset and that depression sets in, and it's okay to be open and honest with your providers and ask for help, ask for counseling. If we need to do antidepressant medication, there's definitely a role for those too. Matter of fact, some chronic pain medications, there are 2 classes that we use often that initially are used for antidepressants that we know now help with chronic pain. And so there's absolutely a tie with some of those same neurotransmitters, those little chemicals that tell our brain how to feel, that are tied to that chronic pain as well. So I think that's a phenomenal point. Thank you so much. So prevention is key. Overarching things, these like really corny things that everybody hears all the time, they are so true, guys. You are what you eat, you move it or lose it. Even a small changes go a long way. And it's not a sprint, it's a marathon, like the tortoise and the hare, you know. Even if people do have these really drastic short-term changes, it's, can you keep that up over time? That's the important thing. Okay. I just wanted to put some of those cliche little sayings in there because they absolutely are true. So an important starting place for people who maybe have been inactive since COVID, maybe are like, man, am I really that out of shape? I'm not that bad, et cetera, et cetera. There are some, especially in the elderly population, we really pay attention to this for our folks that are, I said elderly. And as I age, I realize that I have aunties and my mom is aging. And I'm about to say this age, and I'm not calling y'all elderly, but it's 60 to 65, okay? But 65 years old for our elderly, our aging population. Like as healthcare providers, we pay attention to some of these functional movement screenings because we know that when these numbers or your scores are like on the lower end, that it sets you up for frequent falls, for more frequent hospitalizations, and for higher morbidity, which means like disease processes and injuries that like take away from our quality of life, and even mortality, which means death. Okay. And so some of these tests that you guys can Google, they have a Fullerton exercise battery that I looked up. Our Medicare wellness plans will look at a couple of these tests, and they ask for providers to document them once a year. So the tug test, or the timed up and go test. And that's where you're sitting in a chair, feet flat on the ground. You get up, you walk 10 meters at your normal regular pace, and then you walk back, and then you have a seat. For people who that takes longer than 12 seconds to do, and they're not sprinting to this, so you can't cheat the system by trying to speed walk it, but that has been highly correlated with an increased fall risk for people who take longer than 12 seconds to do that. There are other tests, sit to stand tests, so trying to go from sitting to standing without using your hands, so keeping your hands like crossed at your shoulders or above your head, trying to see how many you can do in 30 seconds. There's like a whole scale to tell you where you kind of fall as far as like strength risk assessment. And I'm gonna be honest, I did this and I was like, ooh, I had to like get some inertia. So I need to work on some of this testing myself. There's a 6-minute walk test, a step test. There's tests for like flexibility, tests for upper body strength and mobility for your upper body. And so there are ways, like if you're like, man, I don't know if I'm out of shape or in shape or where I kind of fall, if you're just curious if you could do these things, that's a good way to kind of see where you stand so that you know like the things that you want to improve on just from a personal level. Okay. There are other tests for younger populations. For cardiac cases, we look at METs, they're metabolic units. And so it's just like how, I don't know, I don't want to nerd out too much on this, but can you burn 4 times the amount of calories in a minute than you could when you're just at rest by doing a certain activity? Can you keep up that activity to be able to get your metabolism up that fast? And so a 4-MET challenge is 2 flights of stairs. So can you do 2 flights of stairs and tolerate that amount of physical activity without it taking you out? Okay. And that's a good indication of cardiovascular activity. So if you're like super dying after you walk up 2 flight steps, you can't carry a conversation for up to a minute or two afterwards, then you should work on your cardiovascular capacity. There's an off the floor challenge. This is important. You will never, one of the most sad cases, and they're sad for a lot of reasons, but are patients who are found down. Any of my co-residents that have had hospital medicine have to take care of somebody who was found down for a while, somebody who fell and couldn't get up. It's sad because, for one, it's like, man, where was their support system? Like, that stinks that nobody found them for 24 hours, 48 hours, whatever it was. But some people can fall and have no injury, but just literally just cannot get up on their own because their functional capacity is just kind of poor. And so what I challenge us to do as we get older is just to get down on the floor, all the way flat, either front facing or down facing, and then see how much extra time or effort that you need to get back up off the floor. If it is taking you a long time to do that, and do it with a friend close, because I don't want y'all trying this alone, because you ain't gonna be found down on my account. You get down and see how much extra effort it takes to get back up. And if you have a struggle with that, have a conversation with your primary care doctor. A lot of times Medicare programs, and once you're over the age of 65, they want to prevent these things. And so they will pay for you to do strengthening with physical therapists and kind of work on that mobility so that you are less of a fall risk, okay? Push-up challenges, sit-up challenges, the time mile, those are things we've been doing since gym class. Like, break out the old school stuff. There's a whole chart to kind of show you like where you fall as far as your fitness with the average person your age. And that also gives us goals to work towards. Like, I don't want anybody to feel dejected if their scores are low, if they're not able to do a lot of sit-ups or push-ups in a minute, but let that be your starting point so that you have something to kind of work towards. Take it as a challenge and not as a defeat, okay? So what is recommended for us to do? Like, how much should we be moving? If the gym is not your thing, I have been lifting weights since I was 14. I prefer that. I don't like to run. I do the elliptical. My Sands, my sorority sister from college, she thinks ellipticals are like, she laughs at me for doing the elliptical, and I don't care. I appreciate it, and it's low impact on my joints. But some people don't like that either. Some people like to dance. Some people like to play sports. Some people like to just take walks in parks and rock climb, and I don't even know what else. But the thing is, if you don't even know what to do to be active, then you have to try and explore some new opportunities to do that. Get creative. Nike just came out with a new commercial with people like absolutely being terrible at sports, new sports that they're trying. And I think that should be our motivation as we move forward, especially after this time of COVID when we could not literally go outside and do anything, to find these new hobbies that we enjoy that keep our bodies moving.
We do one question
Mhm.
while you're on the topic of different exercises. How can we most safely exercise with age to avoid injury? And you kind of actually,
Say that last part again, because my speaker is kind of bad.
how can we most safely exercise with age to avoid injury?
Yes, good question. Listen to your body first and foremost. And so if anything is, things should be difficult but not painful. Okay, that's the first thing. Some people, especially if you're just not an active person naturally and just don't know what things are supposed to feel like, they have a hard time with balance in that. But things that make you limp afterwards, things that are sharper pains that do not go away when you stop moving, that means you kind of did too much. As we get older, our joints naturally have some arthritis. They naturally have some joint wear down. And so you want to be mindful of how much pounding and how much impact that you're doing with new activities, particularly. If you've been running for years, you keep running for years, honey. But if you're just picking it up at 60, I'm not saying you can't do it, but you just have to be mindful of how much you're doing it and how your body feels afterwards. So a lot of it is a feel. If you have known joint issues, particularly knees, hips, etc., then the non-weight bearing, so the things that don't make you pound on them, are options that I would think about too. So bike riding, which is an awesome activity. You can do swimming, which if you're a water person, that's awesome. But if you're not trying to get your hair wet, then that could be an issue. But you can still maybe put a swim cap on and try it. You never know. You might like it enough to do it anyway. There are activities like yoga and like Pilates that are like slow and more rhythmic, but have a phenomenal impact in our overall core strength, which is great.
There's also chair yoga.
And there's chair yoga.
I think that yoga is not, can't be a thing for them.
Yep. And then there are programs that are paid for by our insurances if you're over the age of 65. So your silver sneakers plans, those are paid for. Those are usually gym memberships, y'all, and sometimes even personal training. So look into that. Exercise classes. It's always more fun to exercise or do any activity with friends. So that's a good way to meet new people. I love it. Michelle Obama, she had the Let's Move campaign. That's my favorite first lady forever and ever. And she had this awesome idea to try to help get kids more active. And then that kind of trickled down to family efforts because we know that it kind of starts with the heads of the household. So kids look at us, look at their parents, look at their grandparents, look at their aunties for examples of what things that they should be doing. So if you're kind of sitting on your booties all day, then that might be what they do. And we see that childhood obesity is an epidemic. I am into more of a healthy lifestyle versus a healthy physical figure. So I'm not going to harp a whole lot on like fluffy kids. I just want active kids. I just want active adults. I don't care if you're fluffy or not for right now. I just want people to move. So I'm not going to harp much on that, but she came out with a campaign that just really encouraged people to move, like 60 minutes of play day for kids, 30 minutes for adults. And she had a lot of fun doing it, and she kind of draws you in with her charisma. So you can take a look. That website is still around. Trump didn't take it. And so you can look it up and look at some of those ideas to get moving. Okay. So with that being said, I'm a little over. I'm sorry. I talk a lot, and I was excited because I like this stuff. But does anybody have any last questions or comments or, I don't know, little pearls that maybe I didn't touch on that they think would be worth sharing for our community that's on here today?
Great information, easy to understand. Thank you so much. That's what I read in the chat. Let's move. For those of you who are joining us today, we do have a survey available. It's in the chat. We would greatly appreciate it. Like we said before, this information is for you guys. So if you guys can tell us how to inform you guys, like different ways or method that may benefit you more, please do let us know in that survey that's available in the group chat, and we would really appreciate it. Would you be willing to speak to families? Someone would like to know.
Heck yeah, let's do it. I'm down. Jamisha, you down?
I didn't talk, but yeah, I'm down.
Yes,
Absolutely.
Chris, Mr. Perkins, absolutely. You just let us know, send us an email, or do we have our contact information on our Generation Health website? Like a general.
So, can you actually share the flyer that has all of the information on there? We can also put it in a group chat as well.
Perfect.
Our website is www.ourgenhealth.org. That's OURGEN health.org. And there you can find our Instagram information and our email addresses. And a lot of you on here are family, whether it's by blood or by spirit. So you can definitely hit us up on our personal line to also get that going. I do want to thank everybody for joining us tonight. I do hope that you gained something that may help you or a loved one. Be sure to tune in August 19th. We're going to be discussing something that's pretty new and hot, but also very important, breastfeeding. We'll be discussing that with our very own Dr. McCullough and a lactation specialist. As I mentioned before, the information will be posted on our website and also on our Instagram. So please do keep following and please do check in on our website as well. Thank you, Dr. Motley, so much for dropping these pearls and educating us. I know I learned something. I know I'm a physician like you, but I always learn something during these talks. So thank you so much. Yeah, and if anybody else has any last minute comments, please do share.
Love you, Dr. Motley.
Oh, thanks.
That was great. I just had to talk real fast.
Fam on here tonight. They were tuned in. I appreciate the love, guys. Thank you so much.